Yeovil Hospital, like many others across the country, has been put under enormous pressure through the coronavirus pandemic. And it's had to adapt, like many other healthcare settings, bringing in new practices, like virtual appointments. And that's not about to change, even though some people may be expecting it to.
I think people are expecting things to go back to normal in society, but with regards to the healthcare setting, that won't be the case. We've learned a lot from virtual appointments, the efficiency of virtual appointments, the convenience to certain patients. If people are needed to be seen face to face, we will carry on doing that, but there won't be any wholesale change.
There'll be no change either in infection control measures, even though nationally many COVID restrictions have now been lifted.
We'll still be expecting people to wear face masks, to socially distance, to gel their hands on entry and exit, and comply with all the regulations we've had in place since COVID began. We're seeing a rising number of cases. We have very vulnerable people in our hospital, our patients, and to look after our patients, we're going to maintain our COVID stance and our COVID regulations.
How long will that last, or is that impossible to say?
That's impossible to say. We will look at modifying things on a daily basis, and if there's any changes, we will notify people of that.
How worried are you that people might say, well, I'm sorry, it's not a legal requirement any longer, I won't wear a mask?
Yeah, I think people will have an expectation. I think we're looking at people to be responsible about looking after each other, looking after our vulnerable patients and looking after our staff. And it'll be an expectation that they comply with the regulations we put in place for the safety of others.